everybody. For those of you that don't know me, my name is Jeff Robertson. I'm the Executive Director for the PKD Foundation of Canada. Thank you so much for joining us again this afternoon or this evening, depending on where you're coming from, for another virtual educational meeting. This one, of course, is a very timely and important topic, managing depression and anxiety with polycystic kidney disease. So just before I throw to our presenter, Carla Williams, who will be leading this afternoon or this evening's topic, PKD Foundation of Canada would just like to thank our sponsor, Otsuka Pharmaceuticals, for providing an unrestricted educational grant to make this webinar happen. So we're indebted to them, of course, for giving us this opportunity to provide this information to you all. Carla Williams, as you've read from the e-blasts and communications that have gone out, has worked as a social worker for 10 years, 6 of which has been at the Royal Inland Hospital, and 5 of which were in the kidney care clinic and transplant programs. As part of her role in the renal program, Carla has had the opportunity to be an active member of the following committees: the National Conservative Care Management Committee, the BC Renal Palliative Care Committee, BC Preemptive Transplant Committee, and the Polycystic Kidney Disease Committee. In addition, she has been trained as a facilitator for the Serious Illness Conversation, and at her local hospital, she has created and taken the lead for the palliative response team during COVID-19 and is a member of the Ethics Committee. So please join me in, of course, welcoming Carla Williams. And before everyone starts getting carried away and taking notes, we are recording this presentation and we'll be sharing it with all of you shortly thereafter, hopefully tomorrow. And Carla has been very kind to provide us with some additional resources, which she'll touch on tonight, and we'll pass them along to you. So without any further ado, I'd like to welcome Carla.
Thank you, Jeff, for the introduction. I want to say thank you for having me present today. I'm very happy to be here to talk with all of you about anxiety and depression. I understand that there are people from all over the world on this call, so welcome and thank you for joining. My biggest hope for this presentation is for anyone out there dealing with depression and anxiety to feel comfortable talking about it, and to know that when you have a chronic health condition such as polycystic kidney disease or any other health condition, it is normal to feel depression and or anxiety at times, and it is absolutely okay to talk about. So throughout the presentation, we're going to cover the following topics. So we're going to talk about mental health, specifically depression and anxiety. We'll talk about chronic disease and how having chronic disease can impact your depression or anxiety. The role of the social worker, how we can support you, the assessments that we use. We'll talk about tools and resources, and then we'll talk about COVID-19 and the impact that we have seen that have on people's mental health. So mental health, I just took this quote from Barker. It's the relative state of emotional well-being, freedom from incapacitating conflicts, and the consistent ability to make and carry out rational decisions and to cope with environmental stressors and internal pressures. So this picture I chose purposefully because it is showcasing the mind, which is often what we think about when we consider our mental health. But mental health can also impact our physical body and our overall wellness as well. So here, oh, sorry, next slide, Jeff. Sorry, I'm forgetting to tell you. So mental health, this picture here, I chose it because you can see a person in a wheelchair. You can see somebody signing and somebody using a white cane. These are all things that we can see, but the brain, of course, is something that we can't see its function. Mental health can be considered an invisible disability, and disability also is a word that might imply that it is lifelong. But with depression and anxiety, it doesn't have to be. So what can be tricky about an invisible disability is that it can be overlooked. And when you're coming into your appointments, for example, if you have polycystic kidney disease, you're coming in to see your nephrologist and your nurse, we might not know that anything is happening for you. There might be clues that we might see. For instance, if someone is crying, that might indicate depression. Or if somebody is pacing or fidgeting, we might think that person has anxiety. The other challenge is that human beings are very good at faking how we are feeling. So this picture up at the top, the only thing more exhausting than being depressed is pretending that you're not. And I've heard this before with patients that they'll go on vacation with family and they're dealing a lot with depression and anxiety, and they fake it, and they'll fake it for a week or even more. And they come back home and they feel very exhausted for a very long period of time. Some people might not want to bother other people, or you might want to come across in an appointment as very capable. The person who puts on their best Sunday outfit, makeup, or fancy jewelry, etc., might actually be at their worst coming into the appointment. And even more challenging is that they might not be taking in all of the information that we're presenting. So if they were talking about medication changes, or talking about results of a biopsy or something like that, they might be feeling so overwhelmed that they're not taking in all of the information. The other thing is that healthcare professionals might go ahead and assume then, because you look fine, that you're totally okay, and we might not even ask if you have depression or anxiety. So in my social work introduction with all patients that come into the clinic, I try to meet with every patient, no matter if they need me or not. And I do say those words. I say anxiety and depression is part of my social work introduction. And this is proven to be very worthwhile. I get a lot of head nods and a lot of discussion when I do say those words. It does provoke discussion from that. So, and again, anxiety and depression, I just want to really make sure that people understand it can also impact your physical health. So next slide, we'll talk about anxiety. So everyone does feel anxious at times. Sometimes workplace pressures or public speaking, demanding schedules, or exam writing can lead to worry and even fear. These feelings, however, differ from those associated with an anxiety disorder. So people suffering from an anxiety disorder have intense, prolonged feelings of fright and distress for no obvious reasons. And these feelings can interfere with all of their relationships. And that quote is taken right from the Canadian Mental Health Association. Next slide. So the symptoms of anxiety, I'm going to read them out to you. You can have excessive worry about events or activities, muscle tension, sleep changes, restlessness, exhaustion, difficulty concentrating, racing thoughts, irritability, feeling shaky, avoiding places due to fear, pacing, difficulty catching your breath, worrying about a diagnostic test, and recent fears of losing control. And that's taken from the BC Cancer Agency. Their resources are also really good. They have a lot of resources on their website. But imagine with these symptoms, if you had any one of those, imagine how challenging it is then to absorb the information of a clinic appointment. If we're discussing, again, medication changes, if you're being referred for a biopsy, we might be talking about end-of-life discussions. And then if you're feeling any of the above, you might not be taking in everything that we're talking about in the appointment. So our limbic system in our brain, I'm not going to get all medical on you, but it is the center for our emotions. Anxiety has a physiological response which can hinder our ability to retain information, to focus, and to concentrate. So it's something that happens within our body. It's outside of our control sometimes. So next slide. So I'm just going to talk about depression. So everyone experiences highs and lows in life, but people with mood disorders experience them with greater intensity and for longer periods of time than most people. Depression becomes an illness or a clinical depression when the feelings described below, which we'll talk about on the next slide, are severe and last for several weeks and begin to interfere with one's life and social life. So this one here again is taken from the Canadian Mental Health Association. So with both depression and anxiety, it's the level to which you feel it and for how long, because we all feel depressed and anxious at times, but it's again what level you feel it and for how long. So if my dog dies, I may feel very depressed for a period of time, and this is called situational depression or anxiety. It is normal to have situations that cause us extreme feelings, but when it lasts for a really long time, or if we have less time feeling good, it is a good time to reach out. One thing that I will say is that it really is important for you to talk to your family doctor if you are feeling depressed or anxious, because there are times when the symptoms that you might be feeling could be caused by a medical condition. So it's really good to have that ruled out. Next slide. So the symptoms of depression, again, I'm going to read them out. Feeling worthless, helpless, or hopeless, sleeping more or less than usual, eating more or less than usual, having difficulty concentrating or making decisions, loss of interest in taking part in activities, decreased sex drive, avoiding other people, overwhelming feelings of sadness or grief, feeling unreasonably guilty, loss of energy, feeling very tired, thoughts of death or suicide. So again, taken from the Mental Health Association, Canadian one. So sometimes it can be challenging with these symptoms, with fatigue and motivation, even coming to your appointment. I have seen many times patients do not attend appointments over several scheduled times. And at that point, I'll often clue in, okay, maybe it might be depression, and I'll phone to see if that is the barrier for them attending, because motivation can really, and fatigue both, can impact your ability to even get out of bed or make it to appointments. So depression and anxiety are natural reactions to circumstances that we feel, and sometimes we might feel them more extreme. There is no blame to this. We don't cause this for ourselves, but we can seek support, and that support can make a difference in how we cope and manage. Next slide. So barriers to accessing support for mental health. I know this can be an issue for some, and there are barriers for people to want to reach out. There's stigma, motivation, fear of being labeled, personal values and beliefs, lack of access to healthcare professionals, and lack of awareness of how to gain support or even what support looks like. So in the media, you can read all about it. There's stigma attached. We as a society are really trying hard to break free of this stigma and encourage people to talk about their mental health. We're really trying to normalize it. Our hope is to encourage people to speak up if you are having feelings of anxiety or depression, to recognize that you are not alone, and to ensure that you understand that support is available to you. Motivation can be greatly impacted by mental health, so going outside if you feel anxious can feel overwhelming, and if you're depressed, even getting out of bed can be a challenge. The personal values and beliefs, those are deeply ingrained in people. And people might say to you, oh, you can control your thoughts and your body. There's nothing wrong with you, or family pressures or beliefs. People might suggest to you that you just need to get better. With the lack of access to health professionals, many people, according to 2 articles that I found, one article was from BC and the other one was specifically for Kamloops, where I live. It shows that about 15% of people don't have access to a general practitioner. But if you are one of the people on the call right now that are attached to a kidney clinic, you likely have access to a social worker. So there is a team for you there and you can access them. Anybody who is not part of a kidney clinic or doesn't have access to a general practitioner, there's online resources that you can access. That might be the silver lining of COVID, that a lot of things have gone online. So there's lots of things that you can Google and search. And with this webinar, there will be a list of resources attached to the Polycystic Kidney Disease Foundation of Canada along with this presentation, so you can access that there. And then there's just many people really out there trying to manage on their own. So really just if you know, there are barriers, but if you do reach out, there is support for you on the other end. Next slide. So I just wanted to talk a little bit about statistics. First of all, there's not a lot, and more specifically, not a ton, not any that I could find for polycystic kidney disease. I should reframe that. So I found a couple from the Canadian Mental Health Association. So anxiety disorders are the most common of all mental health problems. They affect approximately 1 in 10 individuals, and more commonly women than men. Depression is a mood disorder which affects about 10% of the population. And then I found a couple renal specific statistics. So in the chronic kidney care population, One study showed that between 7 and 47% of patients identified having a mood disorder. And then that was kind of broad. So another study showed that about 20% prevalence rate. And then with the hemodialysis population, it was reported that between 20 to 30% had a mood disorder. But the bottom line here that I wanted to touch on is that my speculation is that the actual numbers are underreported. I suspect there are a lot of people out there that aren't speaking up and trying their very best to cope. Now, I don't really want the actual numbers to rise, but I think that if people reported more commonly, I suspect the numbers would be much higher than they are being measured currently. So in some ways, I think it would be better if the numbers did rise, because then those people would be getting the support that's available. Next slide. So chronic disease and then depression and anxiety. So that's why we're having this discussion today for all of the individuals out there with polycystic kidney disease. What we know is that individuals who have a chronic health condition are maybe at a higher rate of experiencing depression or anxiety at periods of time. So, for instance, at initial diagnosis, I've heard a lot from people, I wish I'd have known you were here when I was initially diagnosed, because it can be a very scary time. You're dealing with loss of independence, or starting dialysis, or changes to your health, how we view our future, employment and income worries. It's really hard for you to feel, it's really hard when you feel completely overwhelmed to see what's going on and to put logical steps into place. The worry can be too much at times. So if you're worried about your house or kids, or telling your kids about your diagnosis, work and your ability to continue to work, you might have income worries, planning a trip. I've heard of people having to cancel trips. Disability, retirement, uncertainty. There are a lot of reasons that can contribute to depression and anxiety. And then this little picture that I chose is just very true, I find. And I'm going to read it to you. So the truth is, some days I don't give it my best. I don't even give it my all. I can only manage to give it my some, and it's not even that great. But I'm still here and I'm trying, so that's got to count for something, right? So I think that I think it's true, because there are a lot of people who are out there just struggling on their own, maybe putting on their best Sunday clothes to come into an appointment so they appear capable and, you know, that nothing's wrong. But it's okay to talk about it. It's okay to say that you're not doing okay, because we can provide some support to you. And having somebody to guide and assist and to plan as you move through your health trajectory can be really helpful, because not everyone's health trajectory is, you know, going to be a smooth transition. Okay, next slide. So here in BC, we have the BC Renal Agency created provincial standards and guidelines. It was created in 2015. So this slide's pretty busy, but on the BC Renal Agency, you can find this document. But if you look in the larger box, the most important part is if you're attached to a kidney care clinic and you talk to your nephrologist or your nurse, because you always see those people in your clinic appointments, and you mention that you have depression or anxiety, specifically in BC, you will be referred to the social worker. If you don't have a kidney care clinic, if you're not attached to one, or you don't have a social worker, talk to your family doctor. And if you don't have one of those, go online, click in mental health support in your community, and there should be something in your community that can be accessed. So I'll talk later about, in the coming slides, about what social workers can do, but what I want you to know is that you shouldn't be worried about meeting with us. We are actually here just to support you, and we don't make anything worse, and talking about it also won't make anything worse. If you haven't met with a social worker and you know you have one attached to your clinic, don't wait to be referred. Just call the clinic and ask to be put through. And if coming to your appointment is exhausting, you don't need to act like it's fine. I hear a lot of people, and they'll come and see me and they'll say, oh, I didn't sleep last night worrying about what news I would get at my appointment, or I was so overwhelmed in my appointment, I really don't know what was talked about. And so you can feel really overwhelmed. And we can help we can be helpful to you as social workers, and we do have information that might help you to feel more supported, and that support is available, so I say use it. It's my own little spiel. Okay, so next slide. So the role of the social worker. So what can we do for you? We can offer support and hope. We can assess the level of anxiety or depression that you may be experiencing, which I'll talk about in a coming slide. We can offer education about depression and anxiety. We can talk about the supports that are available. We can help you to identify who your supports are. We can build upon that too. We can refer you to appropriate resources. We can provide strategies to help you cope. And a big focus for us is relationship building. The only way that we can really do our job to support you is if you are willing. So you may have access to social work in your individual program. You can meet with us in person. You can talk to us over the phone. We are here, and you don't need to wait to be referred by your nurse or nephrologist. You can just call the main clinic again and ask for us. The relationship building is such an important piece of our work because the relationship that we build is the foundation of what we do. Next slide. So continuing on, we're here to help you have the best quality of life. And then I found this quote and I just loved it. So social workers add life to years, not just years to life. So we help you to have the best quality. And this picture that I chose, I did it purposefully because it's a mess. So life is messy. We just can't help it. But social workers can help iron out the bumps. We can help to detangle the knots. We can help put the ground back under your feet when you feel like the floor has fallen out from under you. We can help you. We can support you. We don't boss you around. We don't tell you what to do or what you should or shouldn't be doing, but we can walk with you when you might have felt alone otherwise. Next slide. So in my work, I work with a lot of individuals who have depression or anxiety. They identify that. And so I asked a few of them what they find helpful. So what they said is, if I fail, you don't degrade me. You listen to me, and that is very helpful to me. You encourage me. I like the understanding, talking to somebody who is not involved in the situation. I like the idea of having someone there in my corner, somebody positive, to give me advice that I wouldn't have thought of myself, and having somebody to talk to and listen, and somebody with an unbiased opinion. So those are all things that the patients that I asked had let me know that was helpful to them. Okay, next slide. And here we'll talk about the assessments that we as social workers do. We use these quite commonly if somebody is expressing that they have anxiety or depression. So for anxiety, we use the Generalized Anxiety Disorder Assessment. We call it the GAD-7. And then for depression, we use the Patient Health Questionnaire. We call it the PHQ-9. So basically what we do is we give you these assessments. You fill them out. For every answer you respond to, there's a points system attached. We add that up, and it will tell us if you're, how mild to severe the impact is on you. So we gauge it for that. And we can use it more than once to gauge whether the support we are offering is helping, or it might even be making it worse, or maybe it's not working, so we need to look at doing something else. So we look at that and we can reevaluate what we are going to do. We can send these to your doctor, and we do that quite commonly, so that your doctor is looped into your circle of care and they know how significant the feelings are for you. And it really just provides us with a starting place and a point for discussion. Next slide. So the tools and resources, I'm going to start talking about that. So when I think about my mental health, I don't know why, I've just always thought of a toolbox. So I always use that analogy. So if I want you to imagine if you had a toolbox with a hammer in it, and that was all you had in it, and you had to build a house, and then ask yourself how successful you think you would be at building an entire home. Now the answer to that, because you can't respond to me, but is not very successful. So when I'm dealing with my own mental health, and I only have, for example, one technique, which is a breathing technique, say it's the only thing I have in my toolbox, how successful do you think I'll be when I'm dealing with all situations that can cause me to feel depressed or anxious? So the answer to that, again, is not very. So because mental health is very complex, and for many reasons I might feel depressed, The more tools that I have at my fingertips, the better off I will be. I might use a breathing strategy when I'm feeling anxious to fall asleep. But if I'm anxious about going into a store with large groups of people, breathing might not be helpful. And I might need to try cognitive behavioral therapy and tell myself over and over that I can do this and that I will be okay. So the more that we have to draw upon, the better off we will be. And we can practice the tools and use them for different circumstances. So the breathing technique might work for one thing, but it might not work for another. But the more we use these tools and practice them in different situations, the more confident we become using them. And then we can feel more confident as we move through our experiences. Next slide. So tools and resources, again, there's two different categories that we put things into. So one is psychotherapy and the other is pharmaceutical. So for the psychotherapy, it's informal and formal supports, which I'm going to talk about the informal and formal supports in later slides. Breathing exercises would fall under this, cognitive behavioral therapy, exercise, diet, sleep hygiene, agency support, which would fall under the formal supports and counseling. Pharmaceutical is medicine, and doctors would follow up regarding the prescription medication that they would prescribe to you. The most important part to remember here is that what works for you doesn't always work for everyone, and same with you know, the tools that we're going to offer you. Like, not everything works for one situation, and not everything works for every person. So, but if something doesn't work, that's okay. We are all different, so just try something else. Go back into your toolbox and choose a different strategy to practice. And remember to try different tools for different situations. So don't completely throw it away, because it might be helpful for a different situation. And in the coming slides, we'll talk about where to find more tools. And some people find that informal supports or breathing exercises are enough. So, but some people find that medication is helpful. And then other people prefer a combination of the two, the psychotherapy and the pharmaceutical. Again, everyone is different and unique in what they find most helpful. It can take time for you to find your balance, but please don't give up hope. We will be here alongside you as you trial what works for you specifically. And again, everybody is unique. Next slide. So here I just wanted to talk about your informal supports. So your family, friends, colleagues, neighbors, church, spiritual faith, pets. Informal supports can be really helpful, and sometimes that might be enough. But we all have really good supportive family, friends, social circles in our lives. But what I have heard also is that some people report that their family or friends can express fatigue with trying to support, or they might express at times that they just don't know how to help. They feel outside of their realm of capability to help you through. But there are more supports available to you, and we're here for this purpose, so please don't hesitate to call or reach out. Next slide. Self-care. I wouldn't be doing my job as a social worker if I didn't talk about self-care. It is really important. So exercise, hobbies, mindfulness, journaling, spiritual activities, sleep, eating healthy, spending time with family, these are all activities of self-care. Taking care of yourself and being kind to yourself is so important. It's a really great place to start. We all know that diet, exercise, and sleep are important. So all we ask is that you start small, but do something just for you and try your hardest to do that every day. We as humans can deal with a lot, and we all know those people who can seem to take on a lot and more, but everyone has a limit, so we all need to be careful. No one can do this step for you. So that's something that you need to know, is that you have to do this part for yourself, but we all have the power within ourselves to take care of ourselves. And I think of myself as a priority, and I do practice what I preach. So I'm going to go to the next slide. So mental health is like any other medical condition. So if I eat a ton of bad food and salt and sugar and fats, my overall health is expected to decline. So I put myself at risk for hypertension, diabetes, obesity, etc. But if I take care of my mental health and I get good sleep, I eat well, I exercise, I spend time with my family, I'm at a better stance for taking on whatever comes. So I try to fill my imaginary bucket so that I don't deplete myself. So some things that I do is I love photography, and I took some pictures for Hockey Canada when the World Women's came to Kamloops a few years ago. My art was displayed there in a grand scale for the tournament, so that was very exciting. I paint, and I do that when I can, so that there's one of my paintings. And then I spend time with family, like I said, and when COVID-19 became more of a concern and we started to prepare for that in the hospital, I vowed to ride my bike to and from work every day as a way to ensure that I was getting my exercise and caring for my own mental health. And to this day, I continue, rain or shine, and it's not always easy. It takes me 8 minutes to get to work and a good 30 to 40 slog going uphill all the way home. So, but I still do it. So, and these are all things that I do, and they take care of myself, but I also am filling my bucket as I'm doing them. Next slide. Okay, so now we're going to talk about the community agency support. So these are your formal supports. So I know that there's people across the globe on this call, so not everything is going to be the same, and I recognize that. But here in BC, and hopefully everywhere, we have a mental health agency. So in BC specifically, we have mental health and substance use, it's called, and it's free. Anyone can join, and it's through the health authorities. So the Canadian Mental Health Association is through Canada, and it's also free, but they have a specific program called Bounce Back, and the link on there for that is there. And they do have all different kinds of programs. So basically you go on, you choose which programs speak more to you and what your circumstance is. But there is one geared specifically for chronic disease, and it's called Reclaim Your Life. And how the Bounce Back works is that you ask your doctor to refer you. And the reason that the doctor refers you is that if at any point during the progression of that program, your depression or anxiety become more severe, they would provide support, or they would refer you back to your family doctor to get that support from them at that time. And then you can re-refer. You can do the program more than once as well, and it's a really worthwhile program. So there's, if you identify as being Aboriginal, sometimes you might be able to access the First Nations Health Authority. There's eligibility criteria for that, but there is counseling available if you do meet the eligibility criteria, which can be really helpful. And then if you're working or if you have extended health coverage, there could be counseling available to you through your extended health benefits. So just if you have that, you can look into that on your own. And then private pay is a fee for service, but there's lots of private pay counseling available in every community, I would think. And it's really common to have reservations around paying for a service, and because it can be costly. But I do want to say that we do pay for dinners out or a new couch or whatever, whatever we like to buy or need to buy. And counseling can really help. So just like self-care, we are investing in ourselves, but sometimes with counseling, we might need to invest in ourselves from time to time, and depending on how we're feeling, and pay that fee for service. And then grief and loss counseling is sometimes available through your local hospice, so you can look into that in your own communities if you do have a hospice. There's a lot of free resources online, and then sometimes through hospice it's peer-led, and other times it's like a small fee or something like that, and it'll be group-led, or you can sometimes do individual. So it varies from hospice to hospice. And again, if you have hospice in your community, but you can look that up. And there's lots of grief and loss support online as well. Next slide. So tools and resources continued. So through BC Renal Agency, I was part of a working group to develop a bunch of resources regarding mental health. So depression, anxiety, managing stress, expressing anger. There's a whole bunch of them, so you can find them if you go onto the BC Renal Agency, and then on the right hand side of your slide, you can see the tabs along the top, and there's one, it says health info. If you click on that, then they'll get a drop down box and you'll come to the mental health, and you just click on that, and then all of the resources will come up. So those are available to you, available to anybody, and they're free. And again, I always want people to know that what works for me doesn't always work for you. So it's okay to try something else and move on to another strategy recommendation, or suggestion. But most importantly, please don't give up. You will eventually find something that works for you, and your social worker or whoever's supporting you will help you to find what works for you. So please don't give up. There's also, again, like I mentioned earlier, these resources are for BC Renal, but there's also some on the BC Cancer Agency, and they're also really good. So both are fantastic. So however you get the resources, they're there. Okay, next slide. So now we are just going to talk about COVID-19 and the impact of that on our mental health. So there's, with COVID, there's been a higher rate of individuals expressing depression or anxiety in relation to that. And a lot of it is because of the uncertainty, the isolation. People are worried about their health. They're worried about contracting the virus. Unemployment, substance use on the rise, financial stress, exposure to media, and delayed rituals. So people of all ages are struggling with a lot of aspects that the pandemic have brought on. So young people with chronic health conditions and people of all ages really with health conditions are worried about continuing to work, or conversely losing their job and having insufficient funds to sustain their home, their medication, provide for their families. The older population might be living in a care facility and not allowed to leave or have visitors, and the social isolation and loneliness is overwhelming at times. Not being able to see family or friends and feeling socially isolated, worrying about our loved ones if they have chronic health conditions or if we do. We don't want to get anybody sick. Job loss and income worry. People are wondering how long this will last, or will they develop a vaccine, so that uncertainty. And people are wondering if they're at risk of contracting the virus. And we might all know somebody who's had to cancel or postpone a wedding or funeral ceremonies, which is part of our rituals that we do in our culture. So all of the uncertainty is challenging and having a great impact on a lot of people. You are not alone if you're feeling depressed or anxiety in relation to what's happening with COVID-19. If you are dealing with anxiety related to COVID, it will be helpful for your team to know this. So if you are coming to your doctor's appointment or you're coming to your kidney clinic, it's important to let us know, because as we talked about the symptoms of depression and anxiety, if you're coming in and you're feeling really anxious also about COVID, I know our clinic is in the hospital, so we're asking people to mask and glove, and we're doing the same. So we can maybe accommodate you to have somebody like a loved one or a support person to come in and accompany you, but we want to be able to make those accommodations. But if we don't know you're struggling, we won't assume that we need to make an accommodation. So it's really helpful to you and to us as your team to know, so that we can help to support you in any way that we can. Next slide. So the COVID-19 resources, this is a list of resources that was developed as a result of the impact of COVID-19 on our community members. This list will be provided to you when it's all uploaded to the Polycystic Kidney Disease Foundation of Canada. But it offers crisis response, virtual counseling, COVID-19, the reputable sources that we would want to share information about, financial support, Aboriginal support, children and youth, adults and senior support, victims of violence, supportive self-management, managing anxiety, sites. There's different sites you can access, mindfulness, grief, self-compassion, substance recovery, and free resources such as coping with current events and managing stress and anxiety. So this will be provided to you. It's an excellent resource, and they're all links that you can just click on. Next slide. So this was again developed because of the COVID-19. It's called Living with Worry and Anxiety Amidst Global Uncertainty. So there's the link there for you if you want to access it. This workbook is very good. It talks about worry, when worry becomes a problem. So like we talked about with anxiety, everyone feels it from time to time, but it's the severity to which you feel it and for how long. So when it becomes a problem and what you can do about it, finding a balance. It offers you ideas or suggestions to keep you busy. It gives you a diagram of differentiating your worries, and it offers you some helpful tips. So that's, again, that link is there for you, and this will all be added to the website. So I'm just rounding the end here. So my takeaway message for all of you on the line is that if you are feeling anxiety or depression, you are not alone. It's okay to talk about it. Talking about it isn't going to make it worse. There is support available to you. Please, please, please do not suffer in silence. And you can be happy. And that picture was taken on one of my hikes all over Kamloops on the hiking trails. People are painting rocks and putting them all over the place. It's very inspirational when you're out, but I really like that one, so thought I would add it. And then we move on to questions.
I'm just going to unmute there. Thank you so much, Carla. That was an incredibly informative presentation, and as we've heard, very timely, given everything that's currently undergo. So for those of you that are on the call, there is a question and answer drop box that you guys can submit your questions. We don't have anything in presently, and we can appreciate that this is a very personal topic, and some individuals may not feel comfortable putting their questions on there. So you're more than welcome to send us your questions afterwards, and hopefully I can work with Carla and we can send them to you on a more personal level and keep it private in that capacity. Just while we wait to see if some questions do come through, Carla, I was curious from a loved one standpoint, if they start to notice, and especially amidst a pandemic, that a loved one, a family member, a sibling is starting to go down the road of depression and increased anxiety, how would you suggest the initial conversation? Like, how would you look to handle that prior to them possibly suggesting they involve a social worker of that capacity?
Yeah, so and support is a really appropriate person to connect with your loved one. And what I would suggest is just be very, don't skirt around it. Ask them, and you can say what you notice. So I've noticed that you've been crying a lot lately, or I've noticed that you feel, or you seem withdrawn, or you're sleeping more. I'm worried. And I'm wondering if you might be dealing with some depression or anxiety or something like that. It's okay to say the words. It's okay to talk about. And it would be important to talk about your observations, what you've noticed and why you're coming to them, and that you're worried. And then ask them. And then if they're okay to talk about it, you can share with them what you've learned today. You can talk about resources that might be available, see if they're willing to talk to their doctor, see what kind of support they might be open to, and encourage them that it's okay to talk about.
And I think, as you mentioned in your presentation, and thankfully, when we provide them with the added resources on the website, and when we email that will be fantastic, because there's a lot of misinformation on the website, or on the internet, I should say, especially when it comes to symptoms and side effects of anything. You can Google a paper cut and think you're going to have to remove your finger. So I think it's important that when it comes to mental health and recognizing those symptoms of depression and anxiety, that they're getting it from a reputable source, getting it from, the Canadian Mental Health Association or organizations and foundations like ours. It's critical that people are given the best description, I guess, of what they're dealing with from reliable sources. Okay, we have in one slide, I've got a question here. In one slide, sleep hygiene was mentioned. What exactly does that refer to?
Okay, so sleep hygiene, I apologize for not addressing that in the presentation. So sleep hygiene is, like, a lot of people will have sleep issues. Either they're sleeping too much, and they're sleeping during the day, and then their sleep at night is impacted, or they're just not able to fall asleep, or they wake up many times during the night and have a hard time getting back to sleep. So there's lots of issues with sleep. So basically what it is developing a routine for sleeping. So going to bed at the same time, and it's different for everybody. Some people like to listen to music. Some people don't watch TV for an hour before. Some people limit what they're eating or drinking before bed. Just making sure that you're doing things the same consistently, and the goal at the end of the day with any type of change you're adding to your sleep is that your quality of sleep will improve. So some people have lights that they can use that are timed, and it will look like the sun is rising in their room, or there's lots of different things you can use, and I think there's some information on it on the, and if not, I'll just send it to Jeff, because I do have specific sleep hygiene resources that I can give to Jeff, and he can add them to the site.
That'd be fantastic. I could use those personally. I had, when COVID hit, insomnia. I started to experience insomnia, so I was only getting about 2 to 3 hours of sleep on average a night. So to your point that you just made about getting it when you can and adjusting accordingly, because sleep deprivation, I mean, is an absolute form of torture. And you can speak to anyone with a newborn or anyone with an anxiety disorder, in the sense that getting those 8 hours of sleep, I know it's not practical for a lot of working people, and especially now, but my goodness, I would take this sleep whenever I could. Just knowing that it was impacting absolutely everything from diet to mood to work, every element of it. Sleep is one of the most important things. And I've tried every trick of the book. You know, I've got the lights, I've got the whistles, I've got the Calm app. But I think it's important that people also recognize too that things can shift. Sometimes without making any adjustments. It's just the natural progression. But then, of course, when you find whether it's meditating or not using your device close to bedtime, that things can get better. And that it will get better is, of course, you know, a massive underlining message when it comes to mental health. And I think that's very important, because when you're in the thick of any of these disorders or a panic attack or anxiety, it can feel extremely daunting. So knowing that there is another side that you're working towards is an important piece to remember. We have a question here from Sonia. I have anxiety. My brother has PKD, and one day I may have to donate my kidney. Will I be denied because I have anxiety?
Okay, so I'm going to answer that very carefully because nobody has to donate their kidney. But the other thing is that you would, if you are wanting, if you're expressing the desire to donate, you would meet with an entire team. And I don't know where you live or what, but in BC, I'll speak specifically to BC. So through BC Transplant and through the 2 hospitals that do kidney donation, kidney transplants, there's teams. So it sounds like your brother would have his own team of people, because he would be the recipient. And then you would have your own team as the potential donor. So they would put you through the same, you know, testing to make sure that there's no potential risk for you to donate. And they would go over all of that with you. So, and I can't answer that. It would be something that the surgeon and the team there would talk with you about. But you would have your own team, and your brother would have his own team, and they would talk about your willingness and desire. And then, of course, make sure that you're a healthy candidate, that you would be able to go through a surgery. So I hope that answers your question, because I can't really answer it.
So we have one from Denise. What would you suggest if a patient has been assigned a social worker at their clinic, but they are not comfortable with this individual?
Okay, I would suggest that if there's another social worker in the program, you know, see if you could, if there's any opportunity for that. And if not, you could maybe set up another appointment with that person and maybe try to talk about where the level of comfort, you know, maybe if there's a barrier with the comfort. If you're absolutely not comfortable, then check to see if you have a mental health agency close to you and see if, you know, if that works.
Okay. We'll just leave it open and see if a couple more pop through. Similar question to Sonia's. If you are willing to be a donor and you are struggling with depression and are taking antidepressants, would that be a challenge? So if someone is willing to be a donor and suffers from depression and takes antidepressants, would that be a red flag for the transplant team?
I think that would be a conversation that you could have with the transplant team. Because all of, like, I as a social worker, I don't get to make decisions about who is eligible and who isn't. And the surgeon and the team that you would be working with if you're wanting to be a donor, they would go through all of that. They would talk with you about it, and they would be the ones ultimately with you determining if it's a viable option for you. So I think you would need to rely on your team for that one.
Okay. Question here from Elise. I'm wondering if you could perhaps speak a bit on the impacts of social media. I see a lot of posts on Facebook groups about the impacts of the disease, and a lot of the comments get really negative.
Yeah.
And this was something, you know, the peer-to-peer support that people can present online can be a blessing and a curse depending on the day and the tonality of that message. So could you speak to that?
Absolutely. So I think there are negative impacts of social media, and I think there is some information in the slides about that, that a lot of people will limit how much they get. And on that COVID-19 resource list, the one that is kind of rainbow color, it does give you the reputable sites, because I mean, we can go into the web and find all kinds of information. Like if I have a cold and I want to know what's going on, I can look at that, and then all kinds of things come up. So it's the same thing when you're looking at COVID-19, or you're looking at, you know, anything that you're looking for in the internet. So on that COVID-19 rainbow sheet, there is reputable sites where you can get accurate information about what is actually happening with COVID-19. And then the other thing that we always recommend with any media, whether it's COVID-19 or just regular news, because it tends to get more negative, and there's always negative articles and things. So we always tend to limit the amount of time we're spending on social media, just being your own regulator for that.
Yeah, I think that's whether one suffers from anxiety or depression, with everything that's happening globally right now, and with elections looming in the fall, I think you see a lot of people talk about social media fatigue, and people, you know, taking the necessary precautions. Some close their accounts temporarily, or, you know, take kind of a vacation from social media. And for me, I can feel the tension and anxiety skyrocket based on just how much time I'm spending on Twitter or the news feeds of that day. So I think knowing for an individual to know their own limits, and to put that into play and know what are triggers can be very important.
And the other thing that you can do too is taking care of your own self. So we all know how to protect ourselves from contracting COVID-19. We wash our hands, we social distance, clean the areas that are, you know, being used more frequently, wear a mask. All of these things will help to mitigate our risk. But again, limiting the amount of time we're spending on social media and going to those reputable sites where you're going to get the accurate information, because there's always going to be a different spin on what's happening. And whether or not that's an accurate spin or something that will be helpful to us might not be helpful, actually.
Great. An excellent question here from Monica. With returning back to work with COVID, there is added anxiety. What techniques can I use at work at my desk to help me cope with this extra anxiety?
Okay, so I think again that cleaning, making sure that your environment is safe, doing what's set out from the health ministers saying what the protocols are for us. And then I think, you know, there's lots of coping techniques that you can use. I think you could try some breathing exercises, or, you know, making sure that you're getting exercise, getting up, taking your breaks. you know, and really trying to control what you can, you know, with the cleaning and the, you know, the protective equipment and things like that. And then, you know, trying to cope using breathing exercises and whatnot. You can, the slides and the information that will be uploaded, there will be more techniques and things that you can try. But again, when I talked about it in the slides, what works for me might not work for you. So it's okay to try multiple things and see what works for you as you start to get back into your work routine.
Great, thank you. Okay, if there are any last minute questions, we've got about 5 more minutes of Carla's time. So of course, if you have any burning questions, here's one now. Along with media, some doctors are talking about a second wave. With some people still not being careful and respectful of others, can you offer some advice on how to handle these people? Especially that everyone is so charged up due to lack of work, kids at home, income not coming in, etc. So it's how to, I guess, handle those that are not necessarily following the protocols that are set forth by health advisories.
Okay, so one thing I know is we can control our own self. So I think in this instance, we need to police our own actions. So washing our hands, using hand sanitizer, using the masks when we go into places. If somebody's coming into our bubble, within that 2 meters, we can ask them to step aside, or if they aren't respecting that, we can move away. We can remove ourselves. I think the biggest thing is that we can help ourselves. I don't know that we can change other people's beliefs or thoughts. We all have the same information. It's what we do with it. So I think taking control of what you can do and how we show up. Yeah. I don't know if that answers the question. And
that's, you know, it's a big undertaking, of course, for people that suffer from mental health disorders, you know, is when you see that, and at times it can be almost looked upon as a personal attack, you know, that someone isn't taking your health or your consideration into place. But if you're what you mentioned a few times there, the importance of knowing that you can only control yourself is a huge one. And that's what we're seeing so much divisive communications right now with people in the community, right? Because people are seeing their personal beliefs being impeded upon. But if everyone kind of just stepped back and recognized that, you know, you can get yourself out of that situation, it might be diffused a little bit easier. We have one here. Can a social worker refer for bounce back or just a doctor?
Just a doctor.
Just a doctor.
Yeah. So usually your family doctor. Sometimes patients don't have family doctors. I know we talked about in the slide here in BC, Kamloops in BC, about 15% of people don't have doctors. So if you have a nephrologist and you don't have a family doctor, you might be able to convince them to refer it in for you. But the idea is that if your depression or anxiety becomes severe, then they need to be able to refer you to somebody who's able to provide you the support that you might need. And then of course you can always re-refer and come back into the program. There's no issue about that. It's just the program doesn't work for the individuals with very severe symptoms of depression and anxiety.
Okay, thank you for that answer. That looks to be all of the questions. We're right on time here, so maybe we'll take this opportunity, or I'll take this opportunity, Carla, to thank you once more for an absolutely fantastic presentation. I know I learned a ton from it, and I look forward to getting this up online. Again, it will be up on npkd.ca with the added resources, the lists that we saw in the presentation, and we'll also be able to send that to you guys directly for those that registered for this. So Carla, thank you so much for joining us today.
I really enjoyed it, and I hope that everybody learned something from it. Thank you.
Great. Thank you all for attending, and please stay tuned to our social media, our newsletters, and our websites for upcoming topics. We will have a handful more of these educational virtual webinars through the course of the next few months, so stay connected. And of course, reach out if there's anything that we at the Foundation can do. Okay, wishing you all a great afternoon and good evening. Bye-bye.